Okay guys, we're ready to start chapter 19 on the respiratory system. And this electron micrograph is showing the pseudostratified ciliated epithelium that we know lines the trachea. And of course those red structures you're seeing there amid the goblet cells are the cilia that we know line the trachea and parts of our respiratory tract. So that's just sort of an interesting fun photograph, I thought, to throw in here. Here's a good question to consider. How many non-smokers die in the U.S. each year from second-hand smoke? The number may surprise you. That's a lot of people dying as a result of inhaling secondhand smoke. As we look at the anatomy of the respiratory system, it's basically divided up into an upper respiratory and lower respiratory tract. And this red line that I've drawn on the figure is approximating the demarcation between those two regions. And what we're going to do next is just kind of take a look and survey some of the structures, starting with the upper respiratory tract. This sagittal section sort of reveals several structures that should look familiar to you. The frontal sinus here and the frontal bone. Here's the hypophyseal fossa of the sphenoid. Here's the pituitary gland right here and the sphenoidal air sinus. And just anterior to that, three of the three pairs of mucous membrane lined nasal conchae. You might remember these are again designed to do three things. As air comes in through the nose, it is moistened as a result of passing across those mucous membranes. It's also, particulates are trapped on the mucus. And thirdly, the air is warmed before it eventually makes its way down into the lungs after passing into the trachea. Another interesting set of structures that we see in this sagittal section are the tonsils. These are actually partially encapsulated lymphatic tissue, and you see three of the major tonsils there, the ones that we're perhaps most familiar with, that are removed typically when somebody has a problem with a lot of sore throat, or maybe they have trouble breathing, are these pharyngeal tonsils located in the posterior part of the pharynx, and often on either side of the uvula here are the palatine tonsils. So these often are the two that get inflamed and cause, again, some pretty severe sore throats in people, usually kids. And they can even impact airflow, as we mentioned a moment ago. When these pharyngeal tonsils get really inflamed, they can impair the ability of the air to pass into the lungs after it comes in through the nostrils. So oftentimes, at least in the olden days, they used to remove these quite regularly. I had mine taken out when I was about 5 or 6. Today they do not remove them very routinely because, as I mentioned earlier, this is part of the lymphatic system, which we're going to talk about toward the end of the semester. And this is a very important system, sometimes called the immune system, to help fight off infections of bacteria, viruses, and other potential pathogens. So generally they like to keep those. If a kid has a real chronic issue with sore throats, because these tonsils are always being inflamed and impacts breathing and that kind of thing, they will remove them, but they don't take them out nearly as commonly as they once did. What else do we see here? The tonsils. Notice this structure right here, the epiglottis. This is a flap which actually will fold over when you swallow. So this obviously is open now. You're not swallowing, you're breathing, so it's allowing air to pass in and out of the lungs quite easily. But when you swallow, this will actually fold down and cover the trachea so that the food that's coming in will be diverted into the more posterior esophagus. And you all hopefully know where that leads, right? To the stomach. And so this piece of cartilage that you see here, sort of in purple, this is epiglottic cartilage. And this is not a new type. It's actually elastic cartilage. It's called epiglottic because it's part of the epiglottis. But what do you remember about elastic cartilage? Well, the term says it all. It can bend. It is elastic, isn't it? So this has to be able to bend when you swallow to cover the trachea so that the food goes down into, again, your stomach. So we're going to zoom in. Here's a view of the larynx from the front. Okay, we've stripped away the skin and the musculature. So this is what is commonly referred to as the Adam's apple. This is that little bump you can feel, more pronounced in men than in women. That's right here. And as you can see, it's made up of what's called thyroid cartilage because your thyroid gland lies right about here. Inferior to that is another piece of hyaline cartilage called the cricoid cartilage. That, of course, is this. And then the other cartilage that we saw just a few moments ago is the epiglottic cartilage. That's up here at the top. And remember, this has to have the ability to bend. We're seeing just a little part of it here. It's mostly hidden by the hyoid bone, which you remember is part of the axial skeleton. We're seeing just a part of the thyroid cartilage. We'll see a better view of that in just a moment. And then at the very, very inferior part of this diagram down here, of course, is the trachea. These are our C-shaped rings, again, of hyaline cartilage that lead down toward the lungs. Here's a posterior view of the same larynx that we saw earlier. Again, the hyoid bone up on top. Here's a better view of the epiglottic cartilage, which again is going to fold down when you swallow. Otherwise, it's open to allow air to move in and out of the lungs with no trouble. We see the thyroid cartilage here as well, and another bigger component of the thyroid cartilage in the back. And then, of course, here's our C-shaped rings of cartilage making up the trachea. This again is hyaline. This is hyaline. This is hyaline, and this is elastic. Here's a view again, posterior view, actually frontal view, I'm sorry, of the larynx. We can see the epiglottis covered by some integumentary tissue here. So the cartilage would actually lie underneath this orange material. Here's the C-shaped rings of cartilage to make up the trachea. So we're cutting kind of through that in a lengthwise sort of manner. And what this slide does a very nice job showing are the vocal cords. And note that there are both true vocal cords, which most people are familiar with, but just superior to that are a pair of false vocal cords or vestibular folds. These, as the name implies, do not play any role in making sound. It's the true vocal cords, which when they vibrate as air passes across them, and we regulate the opening of the space through which the air passes, called the glottis. So the glottis is just a space as air passes across. These true vocal cords in the glottis, they vibrate, and of course you make sound. Think back to that video that I showed you in lab, I think the first day of the semester, of the lady who was standing next to a piano. Her voice teacher was there playing the piano, and she was singing the scale. Remember that? The view from above of the camera, and as she was singing the scale, you could see those vocal cords vibrating, and also the width between them, the glottis size changing depending upon, again, what sort of notes she was trying to reach. Here is a sagittal section of the same view that we saw just a second ago. Again, you can see the false vocal cords here up above, superior to the true cords, which are located just kind of right about here. As we look down from the pharynx down into the larynx, here we have no glottis at all. The true cords are touching one another, so there's no air entering or leaving the lungs. But of course here we see that opening. We can see the C-shaped rings of the trachea kind of faintly here in the back and in the front. So this is leading down into the lungs. And then here's our one pair of cords right here and here. And here's an actual photograph of what we're looking at here in the middle diagram. As we delve down then past the epiglottis and get down into the trachea itself, we see one of the 20 C-shaped rings of cartilage. And to sort of orient you, again, this is the anterior, the front of the body. Here's the posterior, back of the body. And note that this is a C-shaped ring, not an O-shaped ring. So there's a little bit of smooth muscle here. And also we have some epithelial tissue, of course, lining the trachea itself, which you, of course, know on the very, very surface here would be that pseudostratified ciliated columnar that we saw at the very first slide. But when you take a look at the position of the trachea relative to the esophagus, you better understand why this is a C-shaped ring of cartilage and not an O ring. All right, so let me take the purple here and kind of draw where the esophagus is. Remember, it's the more posterior structure. Go back to one of the earlier diagrams, and I pointed that out. So this is the tube leading down into the stomach. Okay, so we are below the level of the epiglottis. And when you swallow food, when you chew up a big piece of hamburger and you swallow that structure is called a bolus. And as that bolus passes down the esophagus, if it's a big enough piece of food, this quite small collapsible tube, the esophagus, may need to bow in this manner as the food passes through the esophagus. And so as a result, the wall of the trachea here, made of smooth muscle, it's going to have to bow inward a bit, as I'm trying to draw here in red. Okay, so this is movable to some extent and basically allows for that bolus to pass down the esophagus. And then this, of course, once the bolus is passed, it will go back to that normal position, you know, back to the kind of the circular structure. This is a histologic section. You've seen this in lab a couple weeks ago, again showing the hyaline cartilage, and if you look super close, you can see all these little lacunae, right, that house the chondrocytes, or cartilage cells, anywhere from 1 to 4 chondrocytes per lacuna. And the matrix, remember, is sort of a glassy pink color. Even though there are collagen fibers in there, you really can't see them unless you really, really zoom in. They're super high power, and even then it's hard to see. And then, of course, here's our pseudostratified ciliated columnar that we mentioned a few moments ago. And the lumen is where the air, of course, here is passing. So kind of an interesting review there of the histology that hopefully you were. Once in a while, we run into issues where somebody's eating a meal and something gets stuck right in that epiglottic, that epiglottis, the flap, and air can't go in and out of the lungs. I think of Mrs. Doubtfire, that movie, that classic movie with Robin Williams, where he gets that piece of shrimp caught in his mouth or in his epiglottis, and he can't get it out. So at that point, what can you do? If you see somebody who's unable to breathe or swallow, well, you try the Heimlich maneuver, right? You've all heard of that. Get behind the person and thrust upwards just below the rib cage to try to dislodge that piece of food. And if that doesn't work, you know, worst case scenario is the paramedics that arrive might have to perform a tracheostomy. So what they're doing is they're basically cutting through initially the skin, a little bit of musculature. They're finding the Adam's apple up here. You don't want to cut through that. You want to go a little bit inferior to that, just below the thyroid gland, which is shown here in yellow. And there's a clavicular notch right here. You can kind of feel where that is. and they call it jugular notch. Sternal notch, I'm sorry, not clavicular notch, sternal notch. So find that little sternal notch, go right above that, and you can kind of feel on your throat here, kind of where that incision is made. And so they're trying to reestablish airflow, get that open, stick some sort of a structure in there, like a rigid rod or something with a hole in it, right? Like basically like a straw, so that the person can get air in and out of their lungs. That's the whole idea here. So it's only done under pretty dire circumstances, a tracheostomy. I think we'll stop this segment right here and pick up with the bronchial tree next.